Okay. So I hope everybody's having a great afternoon.
Afternoon.
Good. So I think just give some of the persons a few minutes to get settled in. Then we can start while others join. Okay. I think Abolarin is still working on his audio thing. And well, it's probably give it about 2 or 3, 4, 5 more minutes. Then we will start. Our intention is to end at 5 so that we can do other things.
What is that? I want to say whether this is normal or
Okay.
come on, not only dark, that you know that I was seeing the man, whether the person intentionally did it. So he's going out. Out. Tell him there's need for him to be on standby now in case there's any problem.
I hope the network will be friendly with us today. We wouldn't have that much. And I know that's one of the challenges that we have is network. But hopefully one of these days we'll get everything right. I hope everyone can hear me very well, right?
Yes.
Okay, good. So 2 more minutes and we will start. I apologize for our tardiness. I know some people are having connectivity issues, but hopefully that will be resolved very soon.
So what I'm saying is that I wouldn't know whether there will be any issue. Whether there will be any issue, that's why I say they're going out.
There will not be any issue.
Okay.
You don't need to touch anything.
Okay.
One is when they need you, just like as we spoke before.
Okay.
Tell you, are you listening to the conversation? Has already notified them that.
Well, I believe we should go ahead and start while the other panelists come in. When they come in, they will join. We will introduce them. Good morning from my side of the pond, and good afternoon at your end.
Yeah, good morning and good afternoon.
Yes, my name is Ifeanyi Nwanoro. I am the president of Center for Innovative and Pragmatic Development Initiative, CIBDI. And this summit was put together by our council, the CIBDI Council on Drugs, Crime Prevention, and Criminal Justice. We welcome you to this online summit. on effects of illicit drug abuse by our youths and its implication, its socio-economic implications. And we have drawn panelists from different fields, and I would introduce them. Ambassador Miriam Hassan is the executive director of LISPADA. She is actively in the field, working to ensure that those of our young people, that she gets them rehabilitated, does counseling for them and all that. I do see that she just sent a text. I think she's having issues connecting with her audio. The next panelist we have is Reverend Ugochimereze Asuzu, who is a senior pastor, the senior pastor of Restoration Charismatic Ministries. We also have among the panelists, Dr. Justice Uchenna Ono, who is a consultant psychiatrist with Nnamdi Azikiwe University Teaching Hospital. He's also a lecturer. The next panelist is Ms. Ifomani, who is an entrepreneur. We also have in our midst Mr. Bolarin Olumide, who is the Public Relations Officer of NSCDC, Lagos State Command. We have Mr. Ome Eyuche, who is also the Assistant Commander, NDLEA, Enugu State Command. 2 days ago, we had other people who also came in up as panelists. Dr. Utman, who is a lecturer with, I believe, Usman Dan Fodio University, and Honorable Mrs. Shirley Munonye, who's also a newspaper publisher. So I want to welcome all our panelists. You all are very much welcome. In whatever order you prefer, I'd like to give you 2 minutes to introduce yourself correctly, and then we can proceed with the entire program. So I think since I'm seeing your face, our Assistant Commander NDLEA, Mr. Ome, so go ahead, please go ahead, tell us about yourself, what you do, and then we'll go from there.
Okay, my name is Mr. Ome Ajay Eyuche. I'm an assistant commander of narcotics in charge of drug demand reduction in Enugu State NDLEA. And basically we have some persons who are drug-dependent persons we are rehabilitating here, both residential and outpatient. We also engage in enlightenment. We also carry out some research on drug substance use, among other things. So these are the things we do.
All right, thank you very much.
Thank you.
For those who are having challenges, probably you're using your phone. Once you sign in, there is a button that asks whether you want to connect with Wi-Fi or data. If you can push on that button, that will connect your audio. And then you'll be able to hear, and we'll also be able to hear you if you are using your phone. Because I found that that's probably most of the challenges is the phone thing. Until you touch that, then you won't be able to hear, and we won't be able to hear you. So thank you very much, Mr. Ome.
Thank you.
Right. In fact, you've just taught me something today. I never knew NDLEA had rehabilitation centers until you just
Yes, we have.
Wow, that's great to know. That's good to know.
Thank you.
Go ahead, Dr. Justice.
Okay. Yeah. Good afternoon, all, and good morning to those in the global south. Yeah. I am Dr. Onu Justice Uchenna. I teach mental health to medical students and postgraduate resident doctors at Nnamdi Azikiwe University Teaching Hospital and University itself. I also also do at Federal Neuropsychiatric Hospital, where I have some honorary posts. What I do for a living is teach people, teach students, and then help those with various forms of mental disorders, including substance use disorders. Thank you very much.
Thank you very much, Dr. Ono, for that brief introduction. I know we'll be hearing more from you. The next panelist, if Honorable Mrs. Shirley Munonye is here, please go ahead and introduce yourself. You can unmute yourself and tell us who you are, what you do. While we're waiting on her to unmute herself, Ambassador Miriam Hassan, I see your audio has connected. So go ahead, tell us yourself, who you are, what you do. You can go ahead and unmute your video, your audio.
Hello, everyone. My name is Ambassador Miriam Hassan from Kano State, Nigeria. I'm the Executive Director, League for Societal Protection Against Drug Abuse, LESPADA, a non-governmental organization that deals with
the TV presenter.
Hello.
So go ahead, let me find where that noise sound is coming from. We can hear you, go ahead.
Okay, as I said, my name is Miriam Hassan, Ambassador Miriam Hassan. I'm the Executive Director of League for Societal Protection Against Drug Abuse, LESPADA, and also the member Special Purpose Committee of the Chairman, NDLELE, General Buba Marwa, retired. I'm also a school teacher, classroom teacher. That's what I do.
All right, thank you very much, Ambassador, for that. We've learned something else. As a class teacher, I know you have so many things doing.
Yes.
You know, wow, my wife, who has been the rock of everything, is also a classroom teacher. Yes, I think she's one of the most compassionate teachers I know.
Yes.
So the next panelist is Honorable Shirley Munonye. If you please unmute yourself and tell us who you are and what you do.
Okay, can you hear me now?
Yes, we can.
Okay. Good afternoon, all.
Good afternoon.
I live in Imo State, Owerri. I'm a publisher of a newspaper called Frontline Express newspaper. And I'm a pastor of a church, a pastor of one of the Christ Embassy churches. I think I'm okay with that.
All righty, thank you very much. Wow. We have two pastors here today. The next person is Dr. Uthman Abdul Kader. If you please unmute yourself and tell us who you are and what you do, sir. We can't hear you, sir. Unmute. You will need to unmute your audio. Thank God for our children.
I'm an associate professor, Department of Sociology, Usman Ford University, where I teach.
All right, thank you very much.
Yes.
Okay, we're still waiting on Mr. Bolorin, the PRO of NSCDC Lagos. I know he can't hear us for now because his audio is shaky, I did send a chat. If you can just press the data/Wi-Fi connection, that will connect your audio. So you will be able to hear us and we will hear you as well. Or if you have your child close by, they may help actually. Thank God for them. They are the ones who actually help us navigate through this challenging digital world.
That's right.
Yes, I saw Dr. Utman. I think one of the children came to help him out. So you see, our children are very, very helpful, especially in this day and age.
Yes.
Okay, here he is. I think his audio is not connected. So go ahead, Mr. Bolorin. You can unmute your audio now and tell us who you are and what you do. Okay, here he goes. So go ahead, tell us who you are and what you do, sir.
I think the audio is still not talking.
Mr. Bolorin, I think I just saw his audio up now. So go ahead, tell us what you do. We can't hear you. Mr. Bolorin, we can't hear you. Okay, he muted himself again. Go ahead, unmute your audio and we'll be able to hear. Okay, well, while he's still working on his connection, let's go ahead and continue. Well, one more time, let me welcome everybody. My name again is Ifani Wanoro. I will be your moderator. Today's session is going to be an open discussion. There's some questions that have been sent to us to ask. We'll ask those questions and give you time to address them. What we really want to accomplish in today's summit is to discuss solutions. Many people, we already know the problems of illicit drugs. And when you turn on the newspaper, when you read the newspapers, you look at social media, everybody's talking about either Mkurumiri or something. He's done this, he's done this. Nobody has actually come out to tell us, okay, how do we solve the problem? So, and that is how, where you experts come in. So you'll be able to tell us exactly what we can do to solve this problem. So our first question will go to those in the security agents. And that will be Mr. Ome, who is with the NDLEA, and also Mr. Abolorin, who is with the NSCDC. What do you think are the security implications of illicit drug use among our youths? Can you hear me? Mr. Ome, can you hear me? Mr. Bolorin, can you hear me? You can unmute yourself.
Yes, can you hear me now?
Yes, I can hear you now.
Okay, Mr. Ome.
Mhm. Go
Mr.
ahead,
Ome,
sir.
can I go? Okay. Thank you for the question you have just asked. And before I answer the question, I want to make some clarifications.
Okay.
You know, when we talk about drug use, and some people out there may understand drug use to be either drug abuse, drug dependence, drug addiction, and all that. So when we talk about drug use in a strict sense, drug use simply means the use of drug without any consequence. That's just in a very strict sense and definition. For example, in 2018, the United Nations rolled out a kind of findings which they did in Nigeria here. And that findings were done by NBS, that's Nigerian Bureau of Statistics, and CRISA, that is Center for Research and Information on Substance Abuse, CRISA, with technical support by UNODC and also funded by EU. And they found out that there were about 14.4% Nigerians who use drug, and which is represent about 14.4%, which represents about 14.3 million. This does not translate to problematic use. They say these people use drug. So when you now come to percentage of persons who actually needed treatment as at that time, so that percent that you talk about problematic use, people who had this, either they are abused or they got to level of dependence. But however, since we're talking about use, let me still use it to mean that these people use it and they had problems. And when they have problems, you know that a drug-dependent person is a threat to his environment, talking about security. It's a threat to any environment where he is, because this person is not acting with a sound mind, meaning that this person, his brain structure has been altered and his behavior equally altered. What he thinks and what he does is just according to the dictate of his mind and what they think at that particular time. For instance, somebody who is paranoidical, the person may feel that, may have distrust and feel that people around me want to harm me. And you see that kind of mindset, and this individual may try to harm people around him. And people who are dependent on drugs can equally go at extra length. Maybe they may take up arms, rob somebody because they want to do what? They want to get money to sustain their habit. These individuals can also steal people things, to sell, just because they want to take drugs. These individuals can actually cause very security breaches, trying to either take dangerous weapons, rape people around them. Some of them, when they do it, they rape people around. They do it, they can snatch cars. And when they are, even go to highways and other places, cultism. So you can understand that when people are under the influence of this illicit drug, they can do a whole lot of things that can actually be termed as a kind of a security problem in our society.
Thank you very much, sir, for that. In fact, clarifying the use, abuse, and dependency. I think what we really want to focus on is dependency, where people really depend on this drug to function. So we really appreciate that answer.
Thank you.
Mr. Abolorin, do you have anything to add to that? Okay. I think he's still struggling with his thing. So the next question will go to Dr. Ono. Dr. Ono, as a psychiatrist, tell us, please, what are the long-term effects of the use and abuse of illicit drugs and chemical dependency?
Yeah. Well, thank you very much for your question. I hope you can hear me.
Yes, sir, we can.
Okay, yeah. First of all, I must tell you that I am really very happy about the job of the panel. Previously, shows the fact that we do understand that the situation, the multidisciplinary kind of can only be addressed by intersectoral collaboration. Then all sectors must have to come in. So thank you for that, the richness of the audience or for the panel. Well, from a medical point of view, we would say that effect of drug could be immediate, and there could also be long-term effects. Now, but what determines the various medical and non-medical long-term effects of the use of psychoactive substances or other substances that have some addictive property? For a particular drug or for all drugs, but there are some peculiarities of each drug. But I'll go further to say that I commonly discuss this in three kind of or two kind of domains. I'll say that there are medical consequences to use of substance, and there are some non-medical, what I can call the psychosocial effects of substance use. Well, the medical ones well known to us. We have the physical and the psychiatric complications of use of substances. I'll just discuss it using some specific examples. For instance, the alcohol. Alcohol is culturally accepted in our communities. So it's culturally sanctioned. And people drink alcohol and we don't make much case about it. But for us clinicians, alcohol has one of the most important long-term effects because it affects all organs, right from the part you put it, from the mouth to the anus. So in the mouth, after a long time, people can develop oral cancers. Any part that the alcohol passes through, there is a possibility of malignancy. In the brain, after chronic use of alcohol, there are certain dementia that is associated or neurocognitive deficit is associated with chronic alcohol use. And in the gastrointestinal system, the liver is one of the most important organs in the body. And the good thing about the liver is that it forgives us if we insult it. But those who use alcohol keep insulting the liver to the point where the liver is shrunken. And then they develop alcoholic fatty liver to liver cirrhosis. So it's a whole lot of medical complications. For instance, cannabis. Cannabis, we know, is very related to development of psychotic disorder, especially when cannabis is started before the age of 15. So there are various consequences in terms of medical. It's unimaginable, you know. So both physical health comorbidities and then various mental health problems is evident in long-term use of substances. But for the non-medical use that we see is what I can summarize with the mnemonic FACE, like the FACE we are seeing. The first of it is family problems. That's the F, the first F. There are a lot of family troubles that is inherent among drug users. Then the A there is accidents that are prone to all forms of accident, through intoxication and all that. Then the C is crime. Certain behaviors aggregate, criminality, use of substances, and antisocial behavior. They tend to co-aggregate. And the first speaker have given us some relationship between substance use and various crimes. In fact, in addition, I also believe that not just the use, but the trading on substance use may also be a source of income or fund for sponsoring and equipping various forms of insurgency in Nigeria. Then the E there is economic adversities that perpetually grow. You may not know what you would have achieved if you were not using substance and when you're using. You may think that some people have achieved something while they use, but they just need to give themselves when they are not using and when they are using to see the possible effect. So I've in a nutshell summarize the various consequences in terms of medical, physical, and psychiatric comorbidities to substance use. I've also given a little exposure to the non-medical complications, which I summarized with FACE. I believe that with more questions, one could also bring out other words, but the consequences are diverse. Thank you very much.
Thank you very much, Dr. Ono. We'll go to the next question will be for Ambassador Mariam Hassan. The question will be, in your view, what do you think is the root cause or what leads people to abuse drugs, in your own view? Why do people use drugs? Go ahead and mute yourself.
Hello,
Hello, yes.
can you hear me?
Yes, we can hear you.
Yes, I think before I answer that question, it's good that we know the categories of drug use.
Okay.
We have the experimental use, where a person tries a drug once or twice out of curiosity, but not use it again. For example, a young person does not smoke maybe cannabis, but was curious when observing friends smoking and having fun. And he decided to smoke with his friends, but disliked the experience and did not smoke again. And then we have the recreational or social use, which is a person which chooses to use a drug for enjoyment, particularly for to improve our mood or for a social occasion. And then we have the situational use, where a person may use a drug to cope with the demands of a particular situation, such as responding to peer pressure, overcoming shyness in a social situation, or coping with some form of stress, either personal or work related. And then we have the intensive use, which is a person may use a large amount of a drug over a short period of time, which may last for hours, days, or sometimes weeks. This can take place over a weekend if it is a period of socializing. And then we come to dependent use or addiction, which is more likely to become, a person is more likely to become addicted on drugs after a prolonged or heavy use. And after that, we have the therapeutic use, which a person uses. Hello?
Hello, yes, we can hear you.
Yes, the therapeutic use is a person uses the drugs for medicinal purpose. And the dangerous aspect of that is that some starts from experimental use straight to dependency use, that is the addiction stage. And when one is addicted to drug, as the first speaker said, there are things that happen both to the person and to the family, as drug addiction not only affects the individual, but the whole family, the communities, the society, and everyone around them. And you're talking about is it the science of, can I have the question again, please?
So the question is,
The
your own
reason,
view, right? What do
isn't
you
it
think
the
is the root
causes?
cause? Yes, why do people use drugs? What leads them to use drugs?
Yes, there are many reasons why people use drugs. Mainly, some use drugs out of frustration. When they are frustrated with life, with their situation, like some of the victims that we came across, they came to our office for counseling. Some of them started doing drugs out of frustration. They dropped out of school, no school fees, nothing. They couldn't even afford anything to pay for their school fees. or to start a trade. So they started doing drugs. And then, like here in the North, we interviewed some women. What they told us is that they went into drug use because of the problem in the home. The men are not forthcoming with their responsibilities. They are the ones doing everything, virtually everything. They care for the children, they pay the school fees, they do everything in the home. And the men are not forthcoming. And then some complain that they started doing drugs because of the treatment they got from their husband also by when he married another wife. That is a second wife to them. And as you know, we call it Kishia here in Kano or the northern part of Nigeria. We call them Kishia, that's the co-wife. And as usual here, maybe when the husband marries another wife and brings her into the home, what they normally do is that they neglect the first wife. And that is one of the reasons why women are into drugs. And then problem in schools. We have many students that are frustrated by teachers or lecturers in their schools. You don't have maybe money for handouts and the teachers or lecturers there. I am a teacher, I know what's happening. So it's one of the reasons why people go into drugs. And then the peer pressure. Mostly the friends play a major role in causing people to get into drugs because
Ambassador Miriam? I think we're losing that connection. Okay, well, let's move to the next question. When she comes back, she'll be allowed to conclude and complete her thoughts. Our next question will go to Dr. Uthman. Dr. Uthman, can you tell us what are the resources and tools needed to address and solve drug abuse among youths in our society?
Let me begin by appreciating the panel for giving me the opportunity. I'm glad to be with you. In Nigeria, we can say that we have several resources, tools, but they are not adequate, or I can say they are ineffective and efficient. What we are lacking in Nigeria is, first of all, we need certain courses, maybe either online courses, certificate, diploma, or degree courses on issue of drug rehabilitation. This is what we are lacking in Nigeria, because you find that in South Africa and other developed societies, you find that they have these schools, courses, and so this is what we are lacking in Nigeria. Secondly, we are also lacking expert. Most of the time now we don't have an expert or specialist in rehabilitation of drug addict. This is what we are lacking in Nigeria. And apart from that, also, we are lacking the tools. That means the test and other tools that can be, that South Africa and other developed societies are using in terms of measuring the content of illicit drugs taken by the drug addict or the youth. You find that in the Western society, mostly the wrestlers, the footballers, and others, they have that tools that they can be able to weigh the measurement, the content of the type of drug individual to. So this is also is lacking in Nigeria. Another thing is the issue of counseling. We are lacking counseling and rehabilitation of our drug addicts. So these are some of the things that we are lacking, coupled with the efficient and effective personnel. We need an effective, efficient, fair, and forthcoming personnel that are nationalistic and patriotic, that can be able to put the empathy of this youth in drug addiction, to see that, to also weigh the consequences and then way forward on this. So these are some of the things that we are lacking in Nigeria.
Okay, thank you very, very much for that answer. We will now go back to Honorable Shelley Munonye. If you would please, I did hear you mention you're a pastor. What do you think should be the role of the church in addressing the problem of illicit drug use? Honorable Munonye, go ahead and mute yourself. Madam, are you there? Okay, we'll get back to her once she unmutes herself. Now, the next question will go to either Mr. Ome and Mr. Bolorin.
Can you hear me now?
Okay, go ahead, Honorable Munonye, we can hear you now.
Okay, thank you very much, moderator. You know, the role of the church is a very vital one. Probably this among the
Yes, you're kind of fading in and out.
wow, maybe the network. Are you hearing me?
Yes, we can hear you now.
Wow. Okay. I think the church has a lot to do in this aspect, because, and for now, I believe also that the church is not doing much. For example, the church has to, one, take this campaign outside the church. Can you hear me?
Yes, we can.
Silence.
Okay. I said we have to take the campaign outside the church.
Okay.
You know, we can't just leave the government to do everything. So for now, even right now, we are planning a campaign to the communities, campaign to the communities, campaign to the schools, you know, to sensitize the youth on how to live without being influenced, one, by peer group, to take what they don't want to take. Then two, we are also trying as much as possible, because the ambassador has said a lot of things. That is the cause root of these problems, which he said, one, depression, you know, lack of care, and some of these youth are having identity crisis. And we want to take this campaign to schools, the church to be able to take campaign to schools, take campaign to communities, using the word of God, even as a tool for this to organize crusade, talking about the use of this drug, the dangers to using this drug, not only for us to stay in the churches, and just preach the word of God only to our, members. We have to do a lot. Setting the government also. There is a proposal we are putting up now, even to take to the FDLEA, this agency to take to the House of Assembly. I'm talking about in most states right now. Taking to the government, the partners. If we come together to partner, to go to these places, I do a lot, organizing boot camp for our youth, doing a lot of things with our youth, bringing them together, teaching them a lot of moral activities. I think it will also help in probing this the use of drugs. Organizing skill activation. There are a lot of people that they are there. They don't even have the skills. They are not going to school. They don't have skills. They don't have anything they are doing. Of course, the idle mind is the devil's workshop. From time to time, if you take out this youth to do one or two things, they will be engaged. Because we are planning to meet the federal house members as well, even to do these things in their federal constituency. There are some that have already been paid, but they don't still have things to do, no funds. They should change them and organize, make funds available for these things. We are still taking this into tertiary institutions. Ambassador said something. He said frustration. Some lecturers are also frustrating the students. I know some people, they have been in the school for 7 years. A course that is supposed to be read for like 3, 4, 5 years. Because of some lecturers, they are still in school. At the end of the day, they are frustrated and they go into taking this hard addictive drugs. So the church has a lot of things to do. The church has a lot to do. So these are some of the things I feel that the church taking out these things out of the church to places, to communities, working with the traditional rulers, working with the community heads, go to call for town union meetings, the youth, taking these things there, the churches, they have what it takes to do them. Thank you very much.
All right, thank you very much. I'm just going to quick follow-up question. You did talk about what the church will do. Now, as a pastor yourself, is your church open or willing to be used as maybe an outpatient rehabilitation center? Why? Let me qualify that question. Here, we do have support groups, maybe things like NA, Narcotics Anonymous, AA, Alcoholic Anonymous. All they do, they come in maybe once or twice or every day, as the case may be. Somebody facilitates that. Nobody judges anybody, just to encourage them, counsel with them, help them through their work with sobriety. Is your church willing and open to facilitate such?
Yes, I think yes. In fact, even let me just put it. We have what is called the inner city mission. That is but I'm talking about the headquarters now. But they are doing some. They pick the students. They pick some of them from the roads, from under buildings. They do then rehabilitate some of them, bring them back to life, and send them to school. Yes, we are open to that.
Okay, great. Okay, we'll circle back to you right quick. And go ahead, Ambassador. You didn't complete before. I think you're...
Yes, yes, I would like to talk on counseling centers.
Okay.
Here in Kano, we have many counseling centers, and by the way, we have 12 rehabilitation centers in Kano, apart from that of the NDLEA.
Okay.
Government-owned and some private ones. We have them here, and they are doing a wonderful job in counseling and rehabilitation. Okay. So we have them here. It's not like, the problem is not about having the counseling centers or the rehabilitation centers. No, the problem is we have to enlighten the people to come forward for treatment, yes, for counseling. People out there are afraid to come forward because of stigma. They are afraid, they are ashamed to accept the fact that, yes, their spouse or their kids are into drug addiction. So they are afraid of that. They are ashamed because they are afraid that the people in the community will shun them, and so many reasons. That's why it's hard for them to come forward for rehabilitation or counseling. And thank God, Lespada, that's my NGO. We are doing a lot on that. We counsel people almost every day. And about the church, here in Kano, we are grateful to the CAN chairman here in Kano State and the pastor of Baptist Church. Has been of tremendous help to Lespada. We've been collaborating with them to sensitize people in the church and in their schools. And it's yielding a great result.
Yeah.
We go from schools to schools, from primary schools up to tertiary institutions for sensitization, because you can't get people to stop taking drugs without them knowing the effects or knowing the truth about the drug itself. What does it do? What effect does it have on them? So what we do is that we go out there, we sensitize them, we enlighten them on the effects of drug abuse and the drug, what the drug itself does to the body, to the mind, and everything to everybody. And also we sensitize families, because as I said earlier on, once a child is addicted or a spouse is addicted, it affects the whole family. It doesn't stop on the child alone or the husband or the wife alone. It affects everyone around him and even the society. So as I said, let me go back to the question. It was my network here is really fluctuating, and yes, and I think let me finish up with the causes of drug abuse. I said frustration, boredom also, as the pastor said, boredom and idle mind is the devil's workshop. If you don't get something, if you don't give them something to do, definitely they sit down, they'll start thinking, the mind will start going, telling them things. So what they do is they go into drugs. And then to deal with physical pain, we had a case of a sickler who is addicted to portwin and weed. He takes it because of the pain. He's in constant pain. And what does he do? He takes he takes weed and the portwin to take away the pain, and then to deal with a life's problem and bad moods. We all have problems, but there are ways that you can manage your problems, and it depending on the kind of person you are. Some people cannot manage their problems well. No matter how little it is, they can't take it. So that's why they go into drugs. And then to fit in, most especially kids or the youths, some of them take drugs because they want to fit in, they want to belong. I want to be like someone. I also want to be that person that people will look up to or something like that. They really want to belong. So they take drugs to do that. And then for relaxation, when you want to relax, some of them take drugs, of course, and they go extra mile to take that drugs. They misuse the drugs, and as a result, they get addicted to it. These are some of the reasons why, the causes of drug abuse. So thank you.
Thank you very much. Thank you very much. We'll now go to Mr. Abolorin. I think I did ask a question before. He has his hand up. Then we'll go to Dr. Justice Ono, who also has his hand up, maybe to shed some more light into some of the things that he has heard. So Mr. Abolorin, I'm going to ask you a question, and maybe you can talk about that as well as the other one that you were supposed to discuss too. The question is this: it will be, once you answer, then Mr. Ome from the NDLA will also answer. We know that NDLA has gone after drug dealers, yet we still see the explosion of drugs in our streets. We see more users somewhere, these drugs coming from somewhere. So how do we turn the curve on this whole thing? What can the society do to help the security agencies in all this whole thing? Because there's now an explosion, regardless of many times we hear X amount of kilos was confiscated or impounded, 1 or 2 persons were arrested, yet with all these arrests, yet there's still explosion of drugs on the streets. Mr. Bolarin, go ahead. Then Mr. Ome would chime in also. Mr. Bolarin, I think I don't know whether can you hear me? Okay, go ahead, Mr. Ome.
Okay, thank you very much. Can you hear me?
Yes, we can.
Okay, like you said, if you look at it this way, that we have actually dislodged a lot of these drug dealers. But what actually happened is that as you are researching, also try to get your intelligence on these people, they are also making their own research and also finding a way of beating security network. So you discover that we have actually dislodged a lot of these persons. But when you dislodge them in point A, be assured that point B, they will gather in that place. As you are getting somebody out of a particular place, go back there in the next 2 hours, you see new people occupying such places. So this goes to show that we really need a very strong network to completely dislodge these persons. Because as NDLA alone cannot do it. So other security organization, we see the other individuals in a community, even some interior villages where they do all these things. If they can also cooperate and come together and see it as a common enemy, I think we can do a lot of things. Because as long as these drugs are available, the consumption will also be there. Except these drugs, the area of dealing or trafficking, selling, if this area is taken care of, you discover that the people who are taking it will be cut off. And again, even when you succeed in dislodging a particular drug or trying to take it out of society, these young people especially, they are always researching and saying, okay, I think we have dislodged these hemp sellers. We have destroyed these people who cartels who also sell some pharmaceutical opioids. Be assured that there are new NPS, that's new psychotropic substances, also emerging. While we are researching, they will research ahead of you also to know where to get these drugs to use. As long as these drugs, they get these new ones, you see that dealers too will now shift their attention to that side, while you are still there trying to make sure that this other one you have dislodged, that you don't see it again in that area. You discover that they will shift their attention to the new drugs that these other young ones are using already. So you see that it's a very complex issues that they, like we have mentioned, a whole lot of people here, the church, you see traditional rulers, opinion leaders, religious leaders, and all, even schools themselves and all that all these persons really need to come together, especially from homes. Families also to check up on their children and know the kind of gang they have joined. And because the kind of gang some of these people have is not only abuse, some of them have also turned themselves to also couriers, people who are selling these things for others. So these are some of the issues. That is why it looks like these things. Okay, let's take a start of this Mkpurumiri, for instance. Mkpurumiri is being done in a clandestine, this in laboratories, not in open. And somebody can just get just a 3-bedroom flat and uses one of the flats to do it. And people around may not understand, may not even know that something like that is going on in that area. And you discover that it becomes very, very hard. It's something that needs a lot of intelligence to discover such a thing. Something that needs a lot of connectivity by either the village, the community itself, and security organization for you to discover such a thing. And as soon as these young people discovers a particular drug, they will describe the kind of pleasurable experience they enjoy from taking such drug, and some other ones also may want to join in. So you see, it's a very complex situation which we all need to rise up to the occasion, saying that, well, it does not concern me, it's only NDLEA, it's only the government. No, people can also volunteer information and see where this is where they are doing it. Some persons who are wealthy can also volunteer logistics and support security agents to go after these persons. Thank you very much.
Thank you very much for that analogy. We really appreciate that. Okay,
Can
Dr.
I say something, please?
Go ahead.
Hello, can I say something?
Yes.
Yeah.
Hello.
Go ahead.
Hello, can hear
Ambassador.
Okay, I believe most people take drugs to change something about their lives. They think that drugs are a solution, but eventually the drugs become the problem. So as long as we have the problems on ground and nothing is done about that, we'll continue having this problem of drug abuse. Every single day, our children will go into drugs. That is it. So the solution is not for the NDLEA or the law enforcement agents to go after the drug addicts. No. What we need is for people, the community, everybody must come together to find a solution to the problem that we are facing that causes this drug abuse. Like one of the drug addicts was saying that the police arrest them for anything and often extort money in exchange to let them go. That is a problem. And sometimes there are no friendly healthcare services near them. These are people that want to stop taking drugs, but they have problems. These problems that are the problems that no one is ready to help. And I think the family, I always underline the word family. They play a major role in curtailing this drug abuse. Once you look out for your child, listen to his problem, stop shunning them, draw them to your to your side. We have a saying that sometimes you beat your child with one hand and you draw him closer to you with the other hand. So we have to wake up. The family have to wake up. The community have to wake up and look into the problems on ground. Otherwise, as I said earlier on, this problem of drug abuse will continue every day. Thank you.
Thank you very much. So what you're pretty much telling us is until we address the problems,
yes,
get people to take drugs, they will continue to take
yes.
it. And another thing is
yes.
the police going after the drug users
yes.
and other than the dealers. Okay, thank you very much for that. Now, Dr. Ono, I think you have something to say, and then go ahead, sir.
Okay, thank you very much for another opportunity. Well, I would say I have some things to say about the church, and then the last question, just a few things.
Mm-hmm.
As a clinician, I I commonly get to see patients with the most severe form of substance use problems, probably those who are dependent or those who have developed other health issues, comorbidity. So, and one interesting thing for us, especially with regards to what the church can do for us, is shortening the duration of time which these people stay on the path to receiving care. Believe me, more than 70% of Africans first seek help through unorthodox means, either through the traditional institutions or the church. And there is this supernatural causation that most patients do have, that these problems is probably caused by the malevolent spirits or other individuals in their vicinity. So commonly, whom do they go to at the beginning of addiction or of substance use when they start having problems? It's commonly their imam, their pastors, their priests. So we cannot take away the role of the church in terms of trying to halt the progression from use to abuse to dependence, because they see them at the most basic level, just like it's also close to what the family can do. So these are all agents of socialization that many people pass through. And many people will listen to their pastor and their imam more than they even listen to us healthcare professionals. So few things the church can do for us is that there is obvious need for tax sharing or tax shifting, where people can be trained, pastors can be trained on low level of care, especially to those who are just beginning to have problems. And they could just help in halting the progression. That's one role the church can do. So people can be trained, church leaders, their pastors, even workers in the church can be given training. And this is not just happening. There is the World Health already knew that access to mental health generally is poor in low and middle income countries. They developed a method where people who are not skilled in terms of professional training in mental health related issues are able to give mental health interventions in the communities. So the church can be a basic a ground where faith and science can be combined to improve the outcome in terms of halting progression in this spectrum.
Dr. Ono, I think we're having difficulties with you.
Then the second is to be able to recognize those who have. Okay, hello.
Yes, we can hear you now. Yes.
Okay, yeah, I don't know where you stopped hearing me. Yeah, okay, so my second point is in terms of reducing the time that it takes for those who already have a very severe form of use to receiving help, because we know from what we know in the clinic that it takes an average of 5 years before somebody gets into somebody that requires a specialist help to get into the specialist. It will take up to 5 years. And where are they before these 5 years? It's either with the church. So what I'm saying is that the church can also recognize those who require some level of higher level of help, and then refer them appropriately early enough, instead of waiting for a long time before the referral. So in fact, so many people that get to come from church to the hospital is when they become destructive, that the church can no longer hold them, that they move them. So the church can reduce the length of time. Then with regards to the question to NTLEA, the one on why people still use drugs despite all the efforts, where the answers have been given, but I still believe that the forces of demand and supply is always there. So you can see that the NDLEA official, they talk more about what they are doing to get those who are dealing on drugs and all that. But he talked a little about what they are doing to improve services in terms of treatment and less likely to recruit new persons. So if we reduce the forces of demand, the supply chain will also invariably be affected. But as everybody has rightly pointed out, it requires a multi-sectoral approach. Thank you very much.
Yeah, thank you very much, Doc. Before you leave, you mentioned something here that is very critical.
Just because what Doc just said now.
Okay, go ahead.
Doc, you see, the problem is the problem we have in our society. Like where I am in Enugu State here, we only have NDLEA, we have a neuropsychiatric hospital, and of course UNTH. They use our center. That is the Department of Psychological Medicine. They use our center for their own services and others. It's covered that we don't really have enough. It's not as if we're not doing something about this. That's why we have people we are rehabilitating here, providing these services. By providing services to, we do referrals even to neuropsychiatrics, and then some other centers, only very few private hospitals who also do this. It's not something that is it's not all commerce affair. Any person comes, you say that, okay, I can know. So everybody's a drug therapist. And the few centers here, they're not just enough. It's not as if these people are not there. I have said, we have people here, as I speak to you, that are under rehabilitation. And the rehabilitation is really the one we do it together with UNTH, the School of Psychological Medicine, the consultant and others. We have some psychologists here. We have social workers. We have guidance counselors. So we do these things here. But you see that every day of our life, you see that our office people, they say this such people come from so many places bringing these problems. But we look at the facilities we have on ground. How many can they take? Sometimes we refer to other states to ensure that these people get these services at the same time. So that is the problem. The problem is, like I said before, that these things we can curtail it if all hands are on deck. I said that some wealthy individuals may decide to say, okay, we are supporting you, building another rehab center to expand the one you have already. Government can come in, other state where we are, can come in also. And so we are also stretching the hand of federal government to ensure that this thing that has been terrorizing our states, that we deal with it once and for all. So we are just here doing the little we can. And I believe, like our new chairman, General Marwa, has said, the man came under this, he's focusing mostly on this issue of drug abuse. Like Ajay had already said, Ajay is also a member of that team. And just recently, he just came this year. And he had told us that he had promised us that he's going to build one standard rehabilitation center in each of the geopolitical zones. That is wonderful. And we have never had it before. And he has taken steps to make consultations and even to ensure that this budget, maybe next week budget, that all these things are part of it. We go. So everything is just about interest and how knowledgeable you are about the whole thing and how you think, you perceive the effect of it all. So that is what the addition I just want to make.
Thank you very much. I just want to tie what you and Dr. said. Both of you pointed out to the church and talked about rehab centers. Yes, we may have rehab centers, however, they're not that much. So no society have. In the US here, we have so many rehab centers, yet we still have the drug misuse. And now, how can we use what we have and stop worrying about what we don't have? We have the church, we have the psychiatrist here, we also have the NDLEA official here, we also have the NSCDC person. How about we come recycle where the NDLA person and the psychiatrist provide training for the church so they can deal with the low-level issues. Hopefully, because what we lack, what Dr. Uthman said here is lack of skilled persons, lack of experts. So we actually have these individuals. Is there a way that the NDLEA, Dr. Ono, can commit to providing some kind of training, be it virtual training, to select pastors and church leaders so they can start addressing some of these low-level things? So in that case, we have a solution.
Yeah, thank you very much, really. Thank you. Well, I must say that this model of, because when you say let us bring a new thing is difficult. It's a little more difficult because it appears that you may need extra budget. But we do have church members, pastors, and all that. We already have them. They are receiving their pay from the church. So, but we can give them other roles which they can also come in to help us. So what you said is absolutely correct. There is a manual, there is a guide, there is a manual developed by WHO. It is called, they were trying to address the gap in mental health and substance use services. And that is what they call MH-GAP intervention guide. Now, this intervention guide is a toolkit for non-specialized people, and they can be trained on how to give some low level of services to people who need help. And it can be done by non-experts in medical field. So in other words, there is already a tool that can be passed down. And I was trained to train people on how to use this guide. Now, this guide focuses on 9 priority conditions. And one of them is substance use. It's like where there is no doctor, just like there's what they call where there is no doctor for primary health care people. They say if a child comes with fever, ask this question. If this is true, suspect malaria. If it is not true, suspect this. It is a very low level of low-level intervention package that can be delivered by non-specialized person, but they need to be trained on its use. And in this case, you don't need to build new house, new hospital. They just deliver it at the point of need. The people come to them in their church and they deliver it. So it can be done, and you can extract this from me as a commitment that if we can have people on the platform, that I'll be able to deliver a training on how to use the substance abuse module of the MH-GAP IG so that people can give low level of care and then make referral when they cannot address it. Thank you.
Thank you very much. Thank you very, very much.
Additionally,
go ahead, sir.
Yeah, additionally, like Doctor just said, that is just very, very true. You know, this issue of substance abuse, before now, law enforcement, they have been doing it the way, the new best, you know, arresting and just like Ajay mentioned, arrest them, deal with them, either extort money or put them behind the counter and all that. But, you know, this recent paradigm shift where we have, it's no longer a criminal justice issue, it is now a public health matter as to align with the international community. And here in Enugu, the other time, an NGO, so UNODC mandated me to be the source person who actually delivered that package to them. That's the DPTC. That is drug treatment and the prevention and care. So we did that with Nigerian police and the prisons. What's the purpose of that? Because we discovered that Nigerian police, it could be other security agency, but they were using Nigerian police. They always have come in contact with these persons, and they do not know the difference between somebody who is just a user and somebody who is a dealer. When they see you with a rap, you are a criminal, you are this and that, and you go in for it. So the essence of this was, how do they work or partner with medical personnel, those in drug treatment units? So how do they work with them to ensure that these persons get the best services they can? That was exactly that, telling them, okay, you really need to shift ground. We know that your own work is to arrest whoever that holds any incriminating items like hemp and others. But then now this individual is sick and he needs a lot of help. And so that whenever they see such persons, instead of taking them to custody, they either refer them to our center here. And that is, we train them and train the Nigerian prisons. And beyond that, I think this, like what the doctor said, the churches and other organizations, they still need for order. There are some NGOs who are doing well in this field also. They still need to collaborate with these churches, NGOs, and because some of us have been trained, I'm a UNODC certified counselor. So we can, like he said, the MPH gap we talked about and all that. So it's a kind of, it's a very friendly model that those who are not in medical field can also use it for their own intervention, So this person can also be trained by not only by medical doctors, but by others who are not medical personnel in a manner that this thing will spread instead of this shortage of this. But the problem is, even when you write these proposals, who is going to sponsor it? Who is going to really look at you and say, okay, oh, this is a very wonderful thing. So we really need more advocacy, probably by those who are highly placed and people who can lobby the National Assembly, probably to see what the government and other concerned individuals can do, so that this type of things can be done, because it can't be just, you can't do it without the resources to do it. Even when you have the personnel, you may have the personnel, but you may not have other resources that you may need to do all those things.
Thank you very much. Something would say, use what you have to get what you need. So am I getting a commitment from you that if these things are set up by some churches that we can use as pilot program, commitment that you will be available to provide some of those trainings? Okay, great. So the next question will go to Reverend Ugochi Mereze Asuzu. I hope you're still there, sir. Then we'll come back to Mr. Bolorin. Reverend Asuzu, can you please, when we ask the question about what the church can do to address this illicit drug abuse and all that, we have seen some videos where people were beaten, stripped naked and all that. And we've also seen videos also trending where people were doing all kinds of things. Now, what do you think about those treatments, and what do you also think that you, the church, can offer to educate people on how to address some of these issues? Reverend Asuzu, let me see if he's still here or he dropped off.
No, I don't think he's still here.
Okay, I think he dropped off. Okay.
Okay, okay. I think he's back. He's back.
Say something concerning
He's back.
Hello, who's?
Say something concerning that.
Okay, go ahead.
All right, thank you very much. Like you asked a question about on how what can do concerning this jungle justice that is really who are the people there? Drug users. Is that your question?
Yeah, that was one of my questions, yes.
Okay. Like I said earlier, the church has a lot to do. Not just the churches alone, but in collaboration with the community, the vigilante, the youth, the villagers, because this is actually happening in the already written that is to be submitted at the court of Israel very late. Now, it is good. The government is not even going to solve anything because what after flogging them, they said you flog 50 but you leave them. Are you leaving them to go to where they are leaving them to do what? It has a lot to do by the community. The youth, we have what is called the, each community have their group heads. We call them together. We're going to start that very soon. Call them together, identify these people. The ones. Are you hearing me?
We can't really hear you. It's kind of faint.
Oh, God.
Let them remove the boat.
Are you hearing me now?
It's little bit, just little bit. So it's kind of faint.
Less salt, more pepper.
Okay, let me see. I think maybe there's some background noise that may be affecting that. Okay.
Agatha's
Okay, I just muted her, yes.
Okay.
And let me also see Mr. Ome. All right, okay. All right, I've muted. Okay. All right, go ahead, man. Hopefully we can hear you. Then we.
Can you hear me now?
Yes, we can hear you.
Okay, I was talking about the jungle that's being carried out in the communities now.
Mhm.
You know, recently someone was flogged 50 strokes of the cane, and 3 days later the boy died. Can you hear me?
Yes, I can hear you, yes.
3 days later the boy died because of the the pain inflicted on him, the wound via the flogging. So I'm saying that for now, the churches are really going to work with the community heads. They're going to work with the youth heads. They're going to work with the vigilante groups. They're going to, with a lot of them in the communities, so that we can really, sensitize them on how these treatments can be done, not just flogging them and leaving them, because it's really helping at all. That is not really helping at all. So we're going to having meetings with them, like the doctor rightly said. Somebody said a training has to be done. If we can train even those ones that are flogging them, the village heads, the youth heads in the villages, in the communities, they will know what to do. But the church, like I said, has a lot to do. They're going to be working with parents. They're going to be working everybody. It's a very big, it's an issue that everybody has to come together, not just the security agencies or drug enforcement agencies. No, we're working with them. Now I have known some people here. If I have some issues where I think I can call them up to come and help me out, I think I'm going to be needing their assistance and help. Somebody rightly said also, when somebody talked about the finances to go about doing these things. Yes, we need finances, and that's why we're going about talking to the government, talking to the individuals that can help also with funds. Because if we bring out groups to come and start going from one state to the other, we need logistics. They need logistics to run this thing. But on our own also, I'm a journalist by profession. I'm a journalist, and I have my own list. And I'm the chairman of the state. So we're going to come together, even as journalists. We have a lot of things to do now. Everybody must do something concerning this issue. It's because it's really, really ravaging our youth, and we are not happy about it at all. Thank you.
You're welcome. Okay, one of the things that we really want to do before I get Mr. Bolorin in is to be able to coordinate this coalition, is to build a coalition where we'll be able to, everyone be part of it. And then we can start addressing these things systematically. And not just addressing it for addressing sake, but with an outcome in mind. One of the things we still go back to the church is because the church is probably closer to the grassroots. If you and the church or some of your colleagues, pastors and other people can coordinate those youth leaders, church leaders, workers, put them together in a building, we are committed to making sure that we get the experts that will provide that training.
That's good.
And coordinate those services. So we are not trying to, we are interconnected. Where your service stops, mine starts. Where mine stops, Dr. Ono starts. So there's a chain, there's an interconnectivity, and there's no break in service, you know, where we start from the beginning to the end, and also the support group. So that is one of the reasons for this summit. So having said that, we're going to recircle back before we leave, and then maybe come up with a call of action and some kind of commitment. I've gotten commitment from Mr. Ome, Dr. Ono, in terms of providing training and other things. So there are other things that we intend doing, not as one organization, but as a coalition to be able to get some of these things done. Mr. Abolorin, we've been waiting to hear from you all this while. Can you please, sir, you've had almost everyone say things. Let us hear from you from your own point of view as a security agent. Mr. Abolorin, we're waiting. I think your hand is up, so please go ahead.
There's a problem with his audio. He's actually talking.
Okay. Well, the next question will go to Dr. Uthman. You did mention, actually, you answered most of the questions that I'm going to ask, but I just want to have a follow-up. You did talk about what the things that are needed. I want you to specify the things that we have now, the tools we have on hand, and how we can utilize those tools effectively and efficiently in addressing these issues.
We can utilize them. Well, as I was saying, those things are what we are missing, because in Nigeria, we have resources as per the network or constellation of NDLEA, police, judges, and so on. But what we are lacking, as I mentioned, those are DOFINE centers, like what we have in South Africa and other developing society. This is what we are lacking first. So we need these tools. And I think if we have this tool, it can go a long way in helping us. First, if we have the training institutions, or maybe institution or department, the universities, or colleges, even online training from certificate up to degree level. So once we have this, we have specialists, and then we have tools. Then if we have this, then the issue of connectivity you are talking about between the faith leaders, community leaders, then with this, I think we can go a long way, because in trying to make this thing work, the faith-based organizations, and then what we have, the institutional institution and these tools can be able to help us to effectively and efficiently deal with this illicit drugs addiction by our youth. I think when we have this, what we also need is a commitment, patriotism, and nationalism on the part of the people, and then that will be able to steer this action. So once we have this, Because if you look at it, Nigeria have a lot of resources, NDA and so on, NDLE and so on. But with the coming of this new leader, Marwa, look at it, he's making a lot of inroad. He's making a lot of way in order to curtail this. So what we are liking is these tools and then resources to be able to have a synergy, to be able to handle it effectively, to serve as a mechanism for prevention, management, prevention, and then controlling this drug addiction. So what we are, when we have this faith-based organization, they can also be helped. Like here in Nanos, we have this Makaranta Allo. That means the Quranic education that will be able to serve an informal social control mechanism that be able to teach about this effect, the negative effect of this illiterate drug addiction to our youth, so that they can grow up to become positive, functional member of the society, so that they will feel ashamed, they will feel guilty for them to take any of this illicit drug addiction. I think if we can have this synergy with these two, then I think we can be able to way forward. And another thing is, up to now in Nigeria and other developing society, we are lacking what we call collaboration. For example, now we as sociologists or criminologists, you find that we are given the theory aspect. We need centers like these dolphin centers to be managed by criminologists and psychologists. So this is what we are liking. So there is a lack of this synergy between we in academic policy makers and NGOs. So we need this collaboration that you are talking about. And with this, when we have this collaboration, each and every one of us will see the functionality, the usefulness, the benefit of each one of us, so that we come together like what we are having now, final of this discussion. So we concretize, and then we make this as an action plan to be taken it maybe yearly or quarterly and so on. So we can be able to reach the promised land. We can be able to at least manage, prevent, and if possible, reduce the level of criminal drug addiction to a very, very minimal level in Nigeria.
Thank you very much, Dr. Uthman. I'll take it that you're also giving us your word commitment to be part of that coalition as well, as we build this collaborative partnership across the country.
I will be glad. I'm very glad to be in.
Okay, great. I believe we're making tremendous progress. Does anyone in the audience have any questions? If you do, please raise your hand and then ask your questions or make your suggestions as we open up the floor. Dr. Ono, can you elaborate so much on the treatment steps so that maybe before we put everything together, we have some kind of the first thing to do. We also know that one thing is about the drugs, the other thing is the withdrawal effects. Can you tell us on what we need to look out for during those withdrawal effects, and what can we do to mitigate some of its dangerous effects?
Okay, well, thank you very much for the opportunity. But before I go to my question, I would also add to you, so you can put in your notes about other resources available that we can ask to treat people with some levels of substance use problems without necessarily creating a new environment. One thing we know is that the primary health care centers exist in every ward, and people go there to treat minor illnesses and all that. So the primary health care centers across all the wards in Nigeria, it's an important focus for a low level of care in people with substance-related problem. That's one other resources already available, existing. We just need to build up the capacity of the people there to recognize and give this level of care.
Okay.
And another resources that is available, that's the last I'll say before my question, is in a mobile app. The truth remains that most young people have access to an Android phone, and interventions have been given successfully using mobile app. So there is no, these things are already available to us. It's just for us to key into it and see how we can use it, because we have to be addressing the problem from all angles. Now, to answer the question on the steps, the steps taken before on during treatment. Well, as I said earlier, that of course substance use is a spectrum. So some people are at the level of use, others are using, and others are dependent. So I believe my question is about people who already have substance dependence, the steps we take in trying to treat them. Now, the first thing to do if somebody comes with a substance dependence of any type, any dependence, whether cocaine, opioids, or all forms, is to check if there is do assessment to check if there are other mental health conditions. Because it's in our own experience, many people don't present to us with pure substance use problem. They present with another mental health problem, and then we come to realize that there is a substance use problem in the same person. So what are people normally recognize before they come is the behavioral change. They know this man has been using substances over years. But when the behavior changes, that's when they now say, oh, he needs to see a psychiatrist. In other words, they do not think that substance use in itself is a problem, but the behavioral change is what they bring. So commonly, in the clinical settings, we see people with substance use and comorbid mental health conditions. Now, what we do in practice is, first of all, we have to treat the mental health condition, because that can impair the patient's ability to follow the drug addiction program. So once the mental health condition is taken care of and the person has capacity to make a decision, we go through what we call motivational interviewing to know exactly the level of change in the individual. First of all, we know that change is a cycle. Some people are in the pre-contemplative phase, that's they don't see their substance use as a problem. Other people may be at the contemplative phase, which means they see their substance use as probably a problem. Other people may be in the phase of decision, that trying to make a decision to change. And other people are planning to take an action or maintain the action already taken. So what we do is to do a motivational to try to know what level of change is this individual. People who go properly into substance use treatment are those who have made decisions to change. Now, that doesn't mean that you leave out those who have not made decisions to change, because you still keep motivating them to see if they can come from the point of not thinking about the change to thinking about the change. So the psychologists are really very useful in this area. So of course, once somebody has made decision and it's time to treat, the first phase is for detoxification. Detoxification simply just means weaning the person out of whatever substance the person is using. Now, once that is done, we now talk about stabilization and maintenance treatment. So in other words, the person have gone through detoxification, then we have to maintain the detoxification. But remember, the clinicians are also interested in knowing whether this person has made decision for abstinence, or whether the person says, well, I don't want to stop the use, but I want to reduce the harm associated with the use. So in other words, the goal of treatment is not just always abstinence for us. We also talk about harm reduction for those who don't want to change or don't want to stop completely. Now, I'm talking about those who want to stop completely. They go through stabilization and then the relapse prevention phase. And the relapse prevention phase is very important because we know that drug use disorder is a chronic disease. In other words, they tend to reoccur after some time. So, but for us clinicians, we don't normally feel very bad if after 2 years, the patient that has been off comes back. We know that during these 2 years of being abstinent, he may have become a graduate, probably married. So he has achieved something. Then we learn from the circumstances that made him relapse and then build him up for the future. So in other words, it's not all a hopeless situation when they relapse. We learn from their experiences and then build them up based on their experiences. They go back, get under 5 years of abstinence, and that's enough to have a child and probably become a postgraduate student. So at each point of abstinence, the person gains something. Then even if he comes back, we don't say, go away, you're a stupid person. So why would you after 5 years come back? No, we don't do that. We learn from the circumstances and then help the person move on in the future. Now, with regards to relapse prevention, it is important that other sectors now come in. For instance, the NA, the AA, these are people who have like a support group, who help these individuals remain abstinent or maintain the vow they have taken themselves. So in summary, the treatment of substance, those who are dependent, of course, those who are not dependent have a low level of care, counseling, psychosocial support, social skills training. These are little things you can do based on what you find. But for those who have dependent syndrome in certain substances, it is not very good to say, let us treat them at home because withdrawal symptoms and can cause death in some people, in some drugs. So to the second question, how do we recognize withdrawal? One of the ways to know is if this person has been away from the drug for some days. So the first question is, has this person stopped using or has he reduced the quantity he used to use? Then after some days, depending on the drug, some are in hours, some are in days. You know, for instance, opioids are in hours. You know, some other drugs can take up to days before the withdrawal, like alcohol, they take maybe 24 hours or plus. They take up to that before the withdrawal symptoms. So the withdrawal symptoms are specific to each group of drugs. I'll just give an example. The one that I commonly discuss is opioids. When somebody is withdrawing from opioids, one of the ways we can recognize it is, I said that the body opens. So the body opens such that the eyes, there is tearing in the nose. The person is having rhino as they're passing out things from the nose. He's sweating, you know. The eyes, if you put a touch there, the eyes will wide open. The having diarrhea. So I said the body opens up, you know, because that is just the opposite effect of the acute intoxication of opioids. So when you are intoxicated, you have constipation. So when you are withdrawing, you have diarrhea. Now, other drugs that are like cocaine that gives you euphoric phase, you take it, you are euphoric. When the patient is withdrawing, they have a crash. Crash means they are depressed, they are dysphoric, they are not feeling, they are feeling sad and all that. The drugs that commonly make you sleep, like the benzodiazepines that we take as sleeping pills, when you are withdrawing, you are most likely to have poor sleep. So the withdrawal symptoms are sometimes the opposite of the effect of the drug. So these are just little ways to know. And when this is the physical symptoms, but there are psychological ways we use to know that somebody is withdrawing, and that is the craving for the substance. This individual knows how to cure himself. That is the truth. He knows that this shake I'm having may just be I've not taken alcohol. He drinks alcohol, the shakes will stop. So the individual knows exactly how to cure himself of the withdrawal effects. But that is a vicious cycle because it perpetuates the use of the substance. So in other words, the withdrawal symptoms are in a nutshell the opposite effect of what the intoxication effects of the drug will look like. And the psychological craving is very severe, such that the individual wants to use the substance with all forms of deception. I have a patient who can ask people to buy food for him and hide it under, or people can climb up the first floor to deliver it through the ceiling. That's the psychological craving. The yearning for this substance is the psychological one. The physical ones are the things I've mentioned, and it's specific to the substance of use. Thank you very much.
Thank you very, very much. I think I have two hands up. Mr. Lukman, Buraimo, go ahead, unmute yourself and ask your question. Mr. Bolorin, we've been waiting on you. I don't know what's wrong with the audio.
Good afternoon,
so
sir.
Go ahead. Yeah, go ahead.
Good afternoon, everybody.
Good afternoon.
This is a very great summit coming at the right time of the society. The use of substance abuse is a very great thing that's really eating into all ends of careers. I belong to the paramilitary. I work with the Nigerian Security and Civil Defense Corps, and we notice that even among the uniformed personnel, this thing is a very serious issue that we really need to talk about. For my own suggestion and my own submission to this summit is that thank God we are having professionals in the house that are willing to help. If we can take this campaign to all organizations, let us set up like an in each agency, in each department, let us have like a community of people, educated minds that can assist these substance users. Because the most abused substance in all organizations is alcohol, followed by Indian hemp. So, but if we now educate this set of committee in each of these agencies and schools, because this thing is really getting to our system. So we have in each school, in each organization, we have this group of educated minds that has been trained by the professionals, including professionals inside, like the sociologists, the psychologists, everybody that needs to be there will be selected from each organization, each schools, each churches, and train them so that they can be helping with this vices inside the organization. I know it will go a very, very long way. And I'm happy we are having volunteers that are really ready to take this campaign to the next level. Dr. Usman, Dr. Onu, all of you are very wonderful people, and your submission is very great. And I'm looking forward to even joining hands in this campaign and taking it to the next level. Thank you very much, sir.
Thank you very much, Mr. Lukman. Mr. Bolorin, if you can hear us, please unmute yourself and say something. We've been waiting to hear from you. We can see your lips moving, but we can't hear. Something is wrong with your audio somewhere. I hope you didn't mute it. I don't know. Can anyone hear him?
Yeah, I can hear you.
I mean, Mr. Bolorin, his lips moving, but
I think there's a problem with his audio. He's actually talking, but we can't hear.
yes. Check your microphone, the microphone of your phone. Make sure it's not on mute. We can see your lips moving, but we can't hear you.
Mr. Bolore, probably you use the speaker of your phone instead of the earpiece. Maybe the mouthpiece is not working fine.
No, yes, we can hear you now.
Can you hear me now?
Yes, we can.
I think the challenge has been probably discovered now. Maybe that's my earpiece. It is well. There's a popular saying that says God's time is the best. I think this is God's time for me.
Good.
Anyway, today I've been operational. I've been up and doing with the commanders. The agency is having promotional exams. I've been on the road. But anyway, I've been following as a faithful servant. First, for all the conversations that have gone down the line, I think in the area of what security agencies such as ours, the Nigerian Security and Civil Defense Corps, should be doing, probably in supporting the NDLEA in their campaign, which we can see the eyes, all eyes can see, even the blind can see in Nigeria, that the NDLEA this time, under the leadership of Brigadier General Muammar retired, the chairman CEO of NDLEA, has done tremendously well, in the campaign against the use of illicit drugs and the abuse of substances in Nigeria, made several arrests and all of that. I think what we should be looking at is what is not far-fetched, and that is interagency collaboration. We need to up our game in the area of interagency collaboration. All hands must be on deck for you to achieve any security goal. No singular agency can do it alone. And to put the facts on the table, the NDLEA, like every other agency, understands interagency collaboration very well. And they have been collaborating with other security agencies, even including the Nigerian Security and Civil Defense Corps, which I'm privy to some of these information as the PRO of the command. But in this regard, we need to synergize more. We need to be more physical with ourselves. This kind of initiative, I think, is bringing all of us together, stakeholders in this business, to ensure that we rid off the society, especially the states that we are, various communities, of these criminal elements and crimes that could be caused as a result of the use of illicit drugs and abuse of substances. And having said that, one thing that is also germane is community intelligence network. For us to be able to nip this situation in the bud, we need an intelligence network that is community-based, okay? We need to work with traditional leaders. We need to work with the obas, the obis, the emirs, the bales. We need to work with the religious bodies. We need to work with non-governmental organizations, the NGOs. We need to work with youth organizations. We need to work with CLOs. We need to work with, civil society organizations. We need to work with the girls. We need to work with the boys. We need to work with platforms, online platforms. Today, the most trending thing that you cannot stop today is online social media platforms. A lot of youth are on several platforms where they bring themselves together to talk about things that interest them. We need to take this campaign to those platforms. Let them see what is wrong in what they are doing. A lot of people don't know that what they are doing is wrong. That's the challenge. That's the foundational problem. If you don't know that what you are doing is wrong, there's nothing that can make you change from what you are doing that is wrong. So these people who use these things most, the bulk of this category has to do with the youth. And a lot of youth campaign needs to be done. A lot of campaigns will be targeted at the youth of Nigeria in different states, in different localities. And at the community level, our leadership is top to bottom, and it also has another angle of it, which is bottom to the top. So it should be vertical and horizontal together. No ends should be loosened. All ends should be tightened. We should be able to reach every sector. Like my colleague Lukman Ibrahim was saying that we need to start cleaning from inside before we now talk about outside. Well, he was looking at the challenge too within the uniform agencies. You know, you want to go and apprehend someone, you want to campaign as a brand or as an ambassador against these things as a uniform personnel, and a civilian is looking at you like, oh, you guys also use it. Okay. So for you to be able to campaign against it, you need to be able to clean from inside. And that is another direction that we need to be looking at. Okay. We need to allow, we need to make sure that from inside, uniform agencies also have information about some of these things and also join in the campaign. And so that majority of them will stop using these illicit drugs. Thank you.
Thank you very, very much for that. And we're about to round up. There was something that Mr. Abolarin mentioned that really struck me. And also Ambassador Hassan said that the coping mechanism, even Dr. Onu said that also. The way I cope with things is different from the way somebody else goes with things. If we can address that, I know here most companies, most employers have something that they put in place. We call it the Employee Assistance Program, where an employee who is going through some issue can call a particular number and on the other end, talk to somebody, and it's purely anonymous. The employer doesn't know what they discussed, and they can use their services as many times as they want to. It's all had to do with dealing with their mental health and their coping ability. So we may look into that also and see how we can integrate that into our system, helping the uniform personnel, because we are living in a very stressful society. And as much as we can help out, Dr. Uthman is here, Dr. Ono, Mr. Ome, these are experts that maybe we can rely on their expertise for our own good also. So I'm going to let Mr. Abdallah go ahead and ask his question or make his suggestion. Then we'll begin to summarize. We'll now let our panelists have maybe say a last word, and then we'll round up. Thank you. Mr. Abdallah, go ahead.
Good afternoon, evening, gentlemen. Sorry I joined late. And I don't know if what I'm going to say has already been discussed. And this is the issue of the cause. What are the causes of drug abuse, substance intake? Because if we try to curtail this only on the top, the root causes are still not identified and tackled, we will continue to face these problems. I'm happy with the last speaker who mentioned that even among the agencies that control this, there are men that are into it. And like the police, if a principal officer in the police, in the civil defense, in NDLEA is into drug abuse, it means he uses his junior ones to get that for him. And it will be hard to control that. We are those on the helm of the affairs into drug abuse. So I would want us to, if we have not already, identify these causes and see the root causes of drug abuse, one of which I know within the precinct that I live is poverty. Poverty has driven a lot of youth into taking drugs so that in turn they are used by politicians for toggery and so on and so forth. So if poverty is one of it, I know there are several other causes out there that we should try to identify and see how we can collaborate with other organizations to get rid of those root causes. Thank you.
Thank you very, very much for that. Any last comments by our panelists? So let's start with Dr. Ono.
Okay, thank you very much. My final thoughts are that, substance use problem is, I've always said that we have actually three emerging epidemics. The first is substance use disorder, opioid dependence. The second is depression, and the third is suicide. Really, these three are interconnected. So in other words, the burden of substance use problem is enormous. Nobody doubts that. Now the issue is, can we care for them? Can we reduce those who are not using from using, and then those who are using not to get to the problematic use? These are all levels of intervention one can give, and each and every one of us have a role to play, either stopping those who are about to use, not to use, or converting back those who have just started using back to not using. So we have a role, either as parents, as pastors, as military officers, and as clinicians. We all do have a role to play. So how can we harness the resources inherent in each of us? Now, this requires obviously collaborations. So what I would suggest is the number of trained experts in Nigeria cannot take the number of patients or people with substance use problems available. For instance, it's estimated that the country has about 300 psychiatrists, which at the last count, maybe 1/3 of them have left to UK. So taking care of about over 180 or 200 million persons. So it's almost one psychiatrist to over a million population, unlike one psychiatrist to 10,000 in Germany. So you can see that there is no how the experts in this area can do this. It's not possible. So we have to do task shifting, so that we have to train lower levels of care to give some level of intervention. Why we can also give interventions for those that they cannot. So in a nutshell, I believe that each of us do have a role. And it is for us to get some level of training, see those we can help, and those we cannot help, we can always call or send to those we think know better. So in other words, any program that is going to be designed for Nigeria must have to go down to the grassroots, to the most lowest level of care. But there must be a pathway for supervision. Thank you very much.
Thank you very much. Before you go, one last question for you. What can we do between now, within a month, to get this ball rolling from your own point of view?
Okay, well, we have already identified the resources we do have. And as I told you earlier, that the primary point should actually be primary healthcare centers and the church. Now, what we can do in the next 1 month is to do we can start state by state or region by region, but I think state by state is a little feasible, where you walk through the National Primary Healthcare Development Agency to nominate somebody who has interest in mental health things for a training on how to recognize, give some low level of care, and then refer those who have a higher problem to specialist centers, because each state do have a specialized center where at least you have one psychiatrist. So I think this is the most feasible. The training, you can do training of trainers first. Why those trainers will now go on to train other people? It becomes a cascade. For the first thing is to take training of trainers. So when we train a primary healthcare person or a church member, we don't expect to be training them again. Those people can also pass on the training to other multipliers. But there must be a mechanism for supervision, because it's not after training, some people do not carry out the act. So there must be a mechanism to reward those who are practicing the act either by the number of referrals they made or the number of people they have seen. So this is the way, either way, reward mustn't be money, but there must be other ways so that we know that people who are trained are doing what they have been trained to do. And it is better to train those, not just going randomly to ask the HOD to send somebody. They think probably you're going to give them money during the training. It's better to nominate people who have this interest. And once they are trained, they start practicing. Because if they don't practice, they will lose it. But if they are practicing, they learn more. And then from practicing, you get to even have more experience in terms of dealing with other things. And you'll be able to train other people. That's what I think we can do in the first 1 month. That's training of trainers, so that those trainers will still go down and then train other people.
Thank you very much. Okay, I think I have a few people who have their hands up. Ms. Vera, go ahead and ask your question and make your suggestion. Then we can go to the next speaker, panelist. Ms. Vera, unmute yourself.
Hello.
Hello, yes, we can hear you.
Okay, greetings, everyone. Hello.
Hello, yes, we can hear you. Go ahead, continue.
Okay. I must say Mungo Day to Ambassador Haja herself, and because I really got her message well, and for me, this is it. The family has failed, so we must go back to our roots. And second to the last speaker, my brother, Mr. Nishima, is it Abdullahi? Abdallah, okay, fine. Thank you so much. He said it. We should start looking at preventive, not curative. The last speaker is talking about curative, which is too big and ambiguous. We can't manage it. I don't know how many TOT you have done. I have done a lot right from the time of HIV, AIDS prevention and everything. A lot of TOT, it doesn't work. Even among teachers, everything, it doesn't work. Let's go down to preventive. And then it's easier to start with preventive. The NDLEA people are there for curative to help us and everything and to cover. But let us go down to what we can easily do. And what is this? Our families. How do we get to those families? Maybe through the churches. Like, I don't know, I'm always calling him Abdullah, he said, poverty is a root cause of this. A lot of people have fallen into depression, which is so bad. Depression, they are looking for a way out. Frustration, they're looking for a way out. Anybody that has, you have gotten gone with anything, go and find out the person is into drugs, because they need to take it to be on the other level for them to do what they can do. So let's start thinking of how to go through preventive, go through our mosque, because I know the Malams are doing a lot. We go through our mosque, we go through our churches, they are doing a lot, and then reach out to these families and say, see, we all are in it, we are all suffering, we need to do something. How do we go about it? Are there support groups to support them? Because even if you go to curative, you cure them, you take them to rehabilitation centers and everything, if they come back, they're going to go back to those drugs. Forget it. We know what we're seeing. The thing just escalated, but I must thank the Kano team, because long ago, they started shouting about this illicit drugs. Even when people are not listening, you know, Haja, I have heard a little about your NGO and what you're doing, Alebia, you know. So it's so wonderful that they started long ago. We were joking about it. Now it's all over. Even teenagers are using Urumiri ice, which is what is raining. How it came about, I don't know. It was like a joke. Some people even start using it as their nicknames. But now it's all over. So you are afraid. You don't know the next person standing around you. A guy that just graduated from Polytechnic Nekede, the guy is now on the streets, mad. Ogini, Ngurumiri eye. So we need to go to preventive. We can easily do it without bogus money, bogus training. You know it, I know it. We read articles, we start talking to each other, we start talking to our families. The pastors can reach out to them, the churches can reach out to them, the malams can reach out to the mosque, everywhere. So we start helping ourselves. When it now goes to the other side, and then they cannot help you. That's when we now start looking for curative. And like Oga in NDLEA said, if we have information, we give it to them and beg them, please use this information, to help us. And I know they are always on standby, like he said. They're always on standby to help. Our problem is when they talk about community policing, we think that it's only to police people, crime, everything. This drug is ravaging us. So we all need to be doing that community policing. You see it, you see something, you say something. If not, the menace is going to hit us really hard, which is already happening. Thank you, and God bless you all.
Thank you very much for that. We need both curative and preventive. If we do only preventive, we would also isolate those who already have the issue. If we do only curative, we'll also isolate the preventive part. So I believe that we should be able to walk and chew gum at the same time. Both need to go hand in hand. And so I think you focus on preventive. One other question follow-up I want to ask is, which will be later on, is how do we solve the poverty issue? I want everyone to have that in mind. That will be something for another day, but just have that in mind. We cannot cover everything today. Go ahead, Mr. Bolorin. Let's hear your final thought and tell us what we can do within 30 days to jumpstart this whole thing.
Okay, already. Hello, can we hear?
Yes, we can hear you.
Okay, already, I think this, the Bible says, don't despise the days of little beginning. This beginning is a great one already because of the concerted effort from different walks of life to find solutions to the subject matter which I'll be addressing. Having premised that, I like to say that family values have been lost. Some of us are not totally perfect, but to an extent, we are good to go. And one of the major reasons we have been good to go and we continue to be good to go is because the family background, the parenting aspect of our lives, the parenting aspect of the life of any child is very germane to national development. It is not until that child is given to the hands of teachers, lecturers, which are primary, secondary, tertiary. We're talking about the informal background of those children. Who are the people that give birth to them? What are the values that they are? What are the things they attach values to? What are the things that motivate them? What are the motivating factors of families? Okay, why should you take to drugs? Are these things taught at all? What are the consequences of taking to drugs? What are the dangers? Where will it land you? And yeah, the overall aspect of it is that you begin to see national security challenge as a result of choices of drug abuse, choices of illicit drugs, choices of even the drug business itself, which is a cartel in the world. Trading of these drugs have become business, trafficking of these drugs have become business, and thousands of tons of these drugs, cocaine, name it, cannabis, go into different countries of the world almost at the same time on daily basis. You hear of the NDLEA arresting, busting these people almost every time. Now, for how long would we continue to arrest? And the more you arrest, is as if the arrest of one fellow, maybe Mr. Hay, is not in any way changing the minds of others, because they see it as, oh, that one is arrested, maybe he doesn't know what he's doing. Some other person wants to try. It's as if they are trying their luck. And if you look at it today in reality, before we begin to campaign against this thing, before we begin to find a solution, we need to first of all do a research. How far can we go? How long can we go? Because how far has this drug thing gone in the world? It has gone beyond now that we want to start. But we have to start from somewhere. So in the whole, you look at the preventive, you look at the curative, you begin to think again that apart from looking at prevention and curing it, let's go back to the historical foundation of families. Because today, a child will be born. That child is not told about the dangers and consequences of, abuse of drugs, we would probably form a cartel tomorrow. So we need to begin to look at forming a family network. That's the initiative I think I want to put on this table. Let's begin to look at forming a family network, advocating family network, in different states of Nigeria and across Africa and the globe, depending on our scope. And begin to see how we push these papers, knowledge-based papers, out there, materials that people can use. I'll begin to find desk officers in different places. We can replicate ourselves. This is a platform that we have started, it can be replicated. We need to bring up youth from these different neighborhoods, okay, on board this platform to hear these things that we are saying. I happen to have the opportunity to represent my commandant in a forum that was organized by, I think, an initiative championed by Dr. Moise Banire. I think it's called UAC. And the NDLA chairman CEO was invited, was ably represented by Mr. Babafemi, the PRO of NDLA. And a lot of things were discussed. A teacher was crying because of the abuse of drugs by a student. The student has become a terror in the school. That child will be feared by parents at home, which was supposed to be the other way around, as in the child fearing, having the fear of his parents or her parents. But it's the other way around. That child is a terror, and he has influenced a lot of children in the school, and that was the thing that the teacher was saying. And all of us were almost crying. And when you ask some of these students, a section of them, that came together, they said, oh, that's a challenge in their schools too. So to just submit, I think family network is important. And from there, we can begin to think of other things on the table, and we'll find a way around that.
Thank you very, very much, Mr. Bolorin, and Family Network Initiative. That's awesome. That's really awesome. Before I take the next person whose hand is up, let's call on Honorable Shirley Munonye to give us her last thought, and also what she believes we can do between now and 1 month's time to address this issue. Something practical. Go ahead, unmute yourself, ma'am.
All right, are you hearing me now?
Yes, we can.
Okay, thank you very, very much. I must say that I've been enjoying myself today after dedicating this so much time for this meeting. In fact, it's awesome. Really, I've learned a lot also. So many things have been said about this, but in the next 30 days, if we continue to look at this thing from the bogus aspect of it, we will not do everything. But we just have to start with whatever we have. Talking about the community intelligence network, we're talking about the family network, we must start something. The campaign is very, very important. The campaign is very, very important. Somebody said something that it is very, very difficult to get something or somebody out on something that you are doing that you don't even know that what you're doing is wrong. Some people take this drug, some youths go into this thing, not even knowing that what they are doing is wrong. So we just have to start this campaign. Somebody said something about, we said all these dealers going into researches. They research one today, they research one tomorrow. If you're an addict, you take the new one, you go out to share your experience with your friends, with your peer groups. And those ones who want to try it too, to feel that your experience, what you experience when you take it. So a campaign is very, very important right now. Sensitizing these youth, going from school to school, using this family network, using this community network, all these things are very important. Using online, online influencers, talking about, each group, different groups, talking about this issue. We have to fill the air with this topic, what we are doing today. We need to fill the air with it. The print media, we really need to go, into it. People writing articles on it and we publishing them. We need to really use this campaign network to go into these youths, the teenagers, the youth, even from the primary schools. We need to really do something. We have to start something. As we start it, going from, campaigning about it, telling people about it, because some of them have not even started using it. Right now, as I talk to you, some people have been planning to go into it. How do we stop those ones that are planning to go into it? So we really need to get to work, start with the campaign, start, fill everywhere, fill the air with it. The online media, the social media, influencers, bloggers, everybody talking about this same issue. But before we hit into the priorities, one of the dogs said, the training, the low level, what they call it, there's something called it, I'm sorry, I just forgot it. You need to train people. As you train these people, you train them, the campaign people are going on, the training is going on, people are talking about it, it's still, the whole thing is everywhere, the schools, the universities, everybody is talking about it. They have different types of drugs they're taking, calling some SK, calling some CK, calling some Colorados, calling them ice. Some of them don't even know what it is. You give it to them, they just take it. One of these days, I went to a teacher's house, teacher that is teaching in the secondary school. He has 10 different types of hot drinks. They have cane sugar there. They mix up all these things, put some substances, and they give to some of these girls to drink. After drinking, they put on doing things and they start doing rubbish. A lot of things are going on. So we need to start this campaign on this issue. Thank you.
Thank you very much for that. So before I forget, I will be co-opting every one of you into, if it's okay with you, let me know. You can shoot me an email or put down your phone number. I will contact you into the CBD Council on Drugs, Crime Prevention, and Criminal Justice, so that we can continue this conversation and this intervention. Ms. Ifoma Anne, you've had your hand up, so go ahead. And after that, I'll call Mr. Lukman, and then we'll go to Dr. Uthman, and Mr. Ome will round the whole thing up for us. Thank you very much. So go ahead, Ifoma.
Okay.
Okay, go ahead, Ifoma. Can you unmute yourself, please?
Okay. Good evening, everyone. Greetings, as in. I'm sorry I joined late. I'm just joining I'm still on the way. Why I choose to join from where I am now. Although I can't do video call because I'm still on the way. So, but I needed to. Although I didn't listen to other people, I just heard about two people that spoke, and they all spoke well. But the issue of illicit drug abuse is a very bogus one, and is a very tedious one. Tedious as far, because I have a case at hand I'm still handling. It's a case of a illicit drug. But one thing we have to know about drug is because when we talk about drug abuse, we only talk about the streets, those people that are already affected. Because there are people who are taking it comfortably. They feel that it has to them, it has no negative effects. Because even in church, as we are talking about, some pastors take it to hide themselves and be able to preach in pulpits. Some priests take it. So all those things, even the military, all those police, whatever, but when we talk about abuse of it, all our mind goes to streets of village people who are taking it. But and that's where the difficulty of handling the case. That's where the difficulty, because like the boy in question, the guy in question that I'm handling his case, whatever, as in, let me just, when we took him to NDLEA, so some of the NDLEA people who are, who are handling him, they were like, you see him, you'll be talking to them, are you people not taking it? Are you people not taking it? So he will be like, all those people, they act as if they are seers. There's some of them, they act as if they are seers. So they'll be kind of pointing those of them that are into it. So wow, I have a low battery. But what I'm trying to chip in is I heard the last speaker saying about we have to start somewhere, or because if we are thinking about being taking the curative measure, it will be a long process. So, but my main suggestion is we can start up a center, what I would say, a kind of will I call it a rehabilitation center in churches, small, or if we can suggest another place where a situation whereby, because they said the journey of 1,000 miles starts in a day. So we mustn't look at the population of people taking it. If we can start, maybe if it's in a year, if we're able to save like 3 or 2 souls, is still something. So if you can set up that center, whereby in a center whereby I heard somebody say that say something about training the trainers, as in whereby people who are trained, they will organize a small center that can take like it wouldn't be much, like 10 or 15 persons in a week, or twice in a week. You talk to them, that we invite addicted persons, whereby who are willing, because one thing I understand about addiction is that person has to be willing to be rehabilitated or to be helped. Because if the person don't have that mindset, it's very hard. It's very hard. Whatever you do, you see the person trying to fall back to it. So in a situation whereby that is a program, but let's use, because if you think of a place, because of fund, we think of churches or speaking to some of the pastors that will give such program a chance in their church, so that we use their church place to organize that, maybe twice in a week or once in a week. We go out for campaign, then we invite some people who are really into addiction, who really want to help themselves, or who really need help, but they can't help themselves. So we invite them there, then we talk to them, then from there we'll start counseling them. Then if the person is willing, to go further into passing through the process of treatment, as in, then from there we can start from there. But let's start from somewhere, because there's a lot of process when it comes to rehabilitation. Is a process, and it's a very long one. So please, I'm sorry I came late, but I apologize. And I just want to chip in this. That's what I want to chip in. Thank you very much for giving me opportunity. Mr. Ifeanyi, thank you.
Thank you very much for your contribution. Now, Mr. Lukman, go ahead, and then I will go to Dr. Uthman.
Thank you very much, sir. I'm grateful for the opportunity, sir. Sir, I would like to come from another angle again. Who are this targeted audience? The youths are now of the majority of people that are into substance abuse. And one of the speakers just told us about influencers. Now look at a beautiful program like this that was well publicized and was shared on serious platforms, and you can see the number of participants in such an educative and interactive program like this. That means people are not really ready for formal discussion of this nature. People are more into entertainment. People are more into other means of communication, except for these formal ones that we are having. Like the schools are not really giving us what we want. So people have really gone into, okay, let's see other means. And substance abuse has been increased from entertainment. Entertainment. You hear some groups call themselves a name, and everybody will want to associate themselves with that. And what is this group about? Substance abuse. And they are having multitude of followers that are following them. So I believe if we can also attack this, if you want to kill a termite infection in a place, you attack the queen termite or their queen. When you kill the queen, then you get rid of the remaining soldiers. So why not we even get the campaign from these people, these influencers? They are the ones, they sing about them in their videos, they show them, because we hardly read. I'm sorry to say, the youth are no longer reading, but we are more onto the social media, we are more into entertainment. So please, why don't we speak a language people would understand, a language that they can associate with? If we continue in the formal way, let's go to schools, let's do this. When you get there, they are not ready to listen because you are not the famous celebrity that they want to hear. But if you put a celebrity up there and the celebrity tells them that, please, I've been wrong all my life, all these things that I've been doing, I put it to you that a lot of percentage of people would follow him in that suit, that if so person can drop this habit, then I can also do it. That is another angle that I'm just looking at it from. Thank you for the opportunity, and God bless you, sir.
Thank you very, very much. You just open another door. I think that's what we would hopefully Mr. Ome and yourself can take these to your high command, and maybe they can talk to some of these influencers and get them to become brand ambassadors of the NDLEA, the civil defense, to be able to reach the youth, while we also look for other youth means, because it's really them. You have to get to them in the language they understand. They don't understand some of the languages we'll talk about because they don't want to. They look at it as obsolete. And who are these dealers? These the youths that are dealing with their fellow youths, experimenting. Hey, I took this and I lasted for 4 hours. You just come, let's party, and I give it to you. And they manufacture, they deal, they sell, and they look very, very innocent. You won't even realize that they're into this thing because they have a way of marking it, and sometimes the parents don't even care. So I really like that approach. Thank you very much for that. Now, Dr. Uthman, your last thoughts and what you think we can do in the next 30 days to continue this, and then we'll come to Mr. Ome.
Thank you very much for the opportunity. I think since you say the first, I think we need to re-emphasize on campaign sensitization through various platforms and medias. For example, we need more radios, television, and then even the radios, we need to go on jungles. We also need to go far in trying to reach them, maybe even in the marketplaces or where we can find, where we can see that we can be able to get them. And then we also need to dwell more on families. For example, we need to involve the family, because you find that family is a basic root, is one of the basic social institutions in every human society. So I've been hearing people are talking about degrading of family value system. So we need to sensitize the parent also, so that to be alive with their responsibility, so that to be able to have a positive parenting that will lead positive functional children and youth free of drug and illicit drug. So we need to push our campaign to focusing on the negative consequences of drug addiction, because you find that every society must take youth to a very higher level, because they are the backbone of every societal development. So if you look at it, youth that are involved in this drug addiction, the issue of their socio-economic status, it has a lot of socio-negative consequences in terms of their education, in terms of their income, in terms of their occupation. Then the country is missing a lot. So I need, in this early days, we need to focus and intensify our campaign, sensitizing and trying to indoctrinate them to be able to know these negative consequences, because the beginning of knowledge is one, to know who you are. Knowing who you are, to tell them that the negative consequences of this drug, illicit drug. And then to push also for this collaboration with the traditional rulers, with the religious leaders. Because if you find it from family to educational to their religious institution, and then to mass media. So I think if we focus more on this, it can be able to help us to know the negative consequences of this. So I think issue of jingle and issue of using this celebrity for jingles and other things, that one can be is a very good help. So I think in for the earlier, this is what we should focus on now. Later, maybe we can move to issue of synergy, and then having more resources on these dolphin centers, schooling and training and retraining. But I think the most important now is campaign, sensitization, and then enlightenment. Thank you so much.
Thank you very much, Dr. Appreciate that, Dr. Whitman. Now to our big brother, Mr. Ome. Please go ahead and conclude. Give us your final thoughts and what you think we can do now in the next 30 days. Because I believe action, we need action in this whole thing. We've had so many talk, so many things, but we just need to start movement. So go ahead, unmute yourself, sir. Mr. Ome, unmute yourself.
Okay, I think I can hear you now.
Yes, we can hear you now. Yes, sir.
Okay. So in 2016 to 17 to 18, there's this team used by UNODC during the International Day Against Drug Abuse and Illicit Trafficking. The team says, listen first. Listen first, listening to children and youths, we help them to grow safe and healthy. So we really need to start listening to children before we bounce on them. So this listening first is just saying, listen to their verbal communications and body languages. So when you see that there are changes in child behavior, what's your reaction? Do you call the child and try to find out, why are you behaving this way? Or you just think it's one of the ways that the young people are behaving? And again, when you see that your child is not doing well academically, do you check up? Like when you look at this, the signs of drug use and other things. And there's a typical example. A principal of a school, a woman, his child was brought to me, to my center, and the child told me, my mother brought somebody who took GC and jumped for me. And they spent 7 years in school, and they discovered that he was withdrawn when he was in second year. The woman was crying and calling the boy name. I said, don't call him names, you are the cause of this. So parents should take note of this. You brought someone to take jam for your child at GCE, one miracle, you want him to perform in university. Definitely no miracle there. That's food for thought for our parents who want to push their children. When they get frustrated in university, they took to drug taking as a kind of compensation for the gap they have already created. Another thing is stigma. Stigma in the sense that when you talk about social reintegration, it starts from the family. How do they accept him because he has used drug or has done so? Immediately, some parents will withdraw all the privileges. I will not pay school fees again. You will not do this again. You think that by doing so, you want to correct that child. Sometimes it might be a way of trying to push him further away from you, and he will now get connected to drug users out there who he will share his thoughts and problems with, and they will now give him other advice because you have created a gap already between you and this your child. And again, the thing may become a kind of, it may come in form of social stigma. And in that sense, the young person who may have this drug problem begin to see him say, okay, so this thing this people are saying, he will now begin to internalize it and personalize it. And it's okay, what these people are saying, that is the way I am. So we should be very careful because like this period we are now, these children we have, their time is no longer our own time. They are existing in a different dispensation where they're exposed to so many things. So we really need to come closer to them because some parents, they do not even have interaction with their children. They are busy pursuing something out there, holding 4 or 5 jobs out there because they want to compete with Mr. A or B, thereby neglecting their primary responsibility of inculcating that culture, the good culture into the life of their children. So parents, we should understand that charity begins at home. And going forward in this regard, I think some of us, you already have our contacts. I think you can just create a platform here. Those of us that are here now, after it can be, you put it open, those who want to be part of it will be there. Lessons, young people, they use this social media more than every other group. We begin to write educative things that are attractive, that are educative also, concerning these drugs and other things that may help these children to read and grow safe. We can start. We have professionals among us and the other persons who may be joining. So I think this is creating a platform immediately, and we start writing ourselves, putting there. When they open their phones, they can see a very catchy subheadings. Like I saw catchy subheading the other time. That one was talking about. He said they say somebody who, how did he put it? A kind of somebody who is a kind of pushing debt or something like that. So we can write something that they can also, let me see what is here. I begin to read those things. You can start, we can start now and create one immediately while waiting for other things. Thank you.
Thank you very much. I really appreciate all your ideas, all your thoughts. It's been a very wonderful session. I believe that we all are in this together. So I thank you. We slated for 2 hours, but we've gone beyond that. So I want to thank everyone and wish everyone a wonderful evening. And those who are in areas where it's still morning or afternoon, a wonderful rest of your day. So thank you very much. I will create that platform and I will get everyone involved in it within the next couple of days. So thank you very much. I appreciate it. So you all have a wonderful evening.